to show the visuals. So that's what our offices look like. We're actually physical space, and have to be a physical space because, with neurofeedback, we do it like people have to come in, and there's a visual of what one of our neurofeedback rooms looks like. And we do a lot of online counseling as well. But I think now people are sort of looking for actually in person, and we created a nice, comfortable space for people to feel welcome for the purpose of therapy. Just a little bit of our history. So I opened the first office in 2019, just before the pandemic, and the intention was to create a clinic that focused on somatic therapies for the treatment of trauma, and working with a group, like rather than individual therapists renting spaces, that it would be a collaborative group model, and that we'd integrate different kinds of therapies, all of them having some kind of like neuroscience, somatically informed approach. And so neurofeedback was an important part of that. So when we designed the space, it was to have rooms that were for neurofeedback and also for psychotherapy, also accessible. It's right, like I'm looking right out here at U of T, the downtown Annex campus. The building is accessible by elevator and the subway, so it's a good location. And so our group has expanded since 2019. We have an extra space where we can also run some small groups, and we offer a range of different kinds of therapies that include, for those of you who are familiar with different kinds of approaches to therapy, EMDR is one of the things we get a lot of people asking for, internal family systems therapy, mindfulness training. Also, we working with psychedelic integration therapy. So people who are maybe working with clinics like ketamine clinics and need to go deeper in their therapy. And then another kind of therapy we offer is called sensory motor psychotherapy. And then we're working towards offering more groups and workshops. That's a bit about us, and that's our team. So we started small, and this is where our team is at.